All right. Well, let's go ahead and get started. Thank you so much for joining us today for our webinar on our request for proposals for the Dallas Rockwall Texas Health Community Impact 2023-2024 grant cycle. We want to share with you today just some information about our priorities for the grant cycle, what we're looking to fund, as well as some of the restrictions, and help you make a determination on where you want to move forward as far as your application. Just a few housekeeping items. We do have a Q&A section, so if you notice the button at the top of your screen, there's a Q&A button there, and you can click on there and submit any questions you have. We'll also provide you at the end of the webinar a link that you can follow and submit an email to us at THCI Grants if you have any questions following our webinar. I am Tawani Arroyo Cruz. I'm the Director for Community Health Improvement with Texas Health Resources. With me today are Narsha Davis, who is one of our program managers overseeing our grants piece for the Dallas-Rockwall region, and Iris Contreras Sereno, who is also a program manager and overseeing some of our special initiatives in the region. So thank you so much for joining us today, and we'll go ahead and get started. All right. So some of you may have heard that the Dallas Rockwall Texas Health Community Impact Team is really kind of data driven. We are focused on addressing some needs that have been identified with our Community Health Needs Assessment, which is a report that is conducted and data is collected for this report on a triannual basis to determine which are the specific needs in the Dallas-Rockwall region that are health related. So following results from this report is how we come up with our regional strategy. And this 2023-2024 cycle, we are looking to partner with community-based organizations to address social determinant of health issues by improving economic stability of low-income individuals with the objective of reducing barriers to health access and to prevent negative effects on behavioral health and chronic disease. So we're really looking for that foundation of economic stability, whether that's through financial literacy or other means, as a basis for addressing some healthcare needs. We know that social determinants of health are not necessarily always addressed head on, and so we are open to engaging with community partners who are interested in leveraging what they have already established. So how will this work? The scope of work for the initiative is based on two things. One is our project goal, and our goal, overarching goal, is to apply a health and wellness lens to programs that aim to improve health outcomes using enhanced coaching strategies. As we mentioned just now, economic stability is really kind of the glue and where we want to base our initiatives, and we want to leverage that economic stability or the lack of economic stability as an avenue for addressing the needs of our community members. As far as our project objectives, there are two. One is to invest in an evidence-informed research initiative that enhances financial coaching practices by incorporating a life coaching model. What do we mean by that? We mean that we know that there are already some organizations doing financial literacy work. We know that there's some coaching happening in communities with individuals who are considered low income, who are considered underserved. What we want to do is to pair that with some opportunities to enhance the financial coaching and expand upon that to more of a life coaching model that allows us to then incorporate some goals that are specific to addressing healthcare needs, whether that's health access, access to healthier foods, access to resources that help an individual be in better health and wellness. The second objective is that the model needs to focus on addressing the needs, values, and priorities of low-income individuals at risk for behavioral health and chronic diseases. So specifically, when you're thinking about recruiting individuals to participate in this collaborative initiative, we're thinking of individuals who are low income, who have potentially obesity, issues with diabetes, and other concerns, or have a family history that puts them in the category of being at risk. And so those are things that we're thinking about as we're trying to address the overarching objective of applying this health and wellness lens. We want to be able to assist and provide support to those individuals, but also get them to a place where they are healthier and in a better position. So applicants who are interested in this RFP need to do a few things. One is to design and implement an intervention that aims to enhance the well-being of individuals. Two, to employ approaches that build on existing financial and or life coaching programs to include a health and wellness component. Again, that foundation is really important. We're not looking for you to come up with something brand new. We're looking for you to leverage the existing work that you've done, or or that your partners have done, that are focused on coaching or financial literacy, and build upon that so that there is a basis for that additional health and wellness component. Third is to use an evidence-informed research design. By that, we mean that we want you to really think through, as you put together your collaborative, who are some potential partners that can help you design a formal research project? Who are the partners that can help you determine, how you can have a structured program so that you can actually assess what is the effectiveness of the intervention that you've designed, and what are those outcomes? So we need someone that will work with community-based organizations who potentially are implementing the project, but also can step back and view it from more of an evaluative lens, a research-focused lens, and help you to identify how will you say that you have been effective in delivering this intervention. What are the specific outcomes that will help you to make that case? Um, Four, we want there to be a collaborative partnership. So when we talk about a collaborative partnership, it's really a group of organizations coming together with the intent of helping us to reach that goal, right, of enhancing the well-being of individuals. That collaborative partnership usually will have one organization that serves as a lead and is the primary contact with Texas Health. And so that's what we're looking for. That helps us to manage in terms of the administrative burden of working with multiple organizations, but it also shows that there is a possibility that multiple organizations who are doing similar work or complementary work can work together collaboratively to help us achieve this objective. And number five is to prioritize establishing those partnerships with local organizations to expand upon existing efforts. So you may have a collaborative that includes three organizations, but you work between the three of you, you work with 10 or 15 different organizations. That is absolutely feasible. We're not necessarily looking for you to build a huge collaborative, a huge partnership, or we're wanting to have some organizations who are obviously responsible for designing the interventions, responsible for overseeing and making sure that the work is happening, and then also helping to evaluate and show and be able to demonstrate that there are outcomes related to the work. So what are our expectations? In our collection of data for the community health needs assessment, we have determined over the past 6 years, in fact, that there are some very poignant needs in the West Dallas area in 75211, 75212, The Southern Dallas area, Southeast Dallas specifically, 75217-227. The Vickery Meadow area, and 7521231 and 75243 in the Forest Lane area. As well as South Rockwall in 75032 and Royce City 75189. The reason why we are guided by zip code areas is because we're able to capture the data and show that there is a specific need for those areas. And so we are driven by zip codes, and we are, geographically focused in our efforts to fund communities. So our priorities are really going to be these areas. It is possible that your organization works with more than these zip codes, and that's okay. But just consider that as we are reviewing applications, we are going to be looking at applicants who prioritize these specific areas, and even more so Dallas than Rockwall because of the disparate population need and the population size. Um, and then preference will be given to collaborators partnered with local organizations that have a history in the target community. So we want to see as a part of your application that you have already engaged with community members in these areas, that you have potentially a long history or existing programming in these areas that support your ability to do this work. So going back to lead organizations, what we're going to be looking at as far as your application is we want to have one organization submit an application. The applicant will serve as the lead organization. It could be that there's one of the partners that wants to submit the application. That's okay. And you can specify that in your application, but we are looking for one organization that's a part of the collaborative or the partnership to submit the application and demonstrate how their specific project or program will promote community engagement and significantly improve health outcomes for those who participate. So under that one umbrella, you're going to be developing and implementing programming that is rooted in effective coaching methods for addressing health concerns through economic stability practices. You're going to be incorporating a solid research design and a rigorous evaluation plan to collect evidence of impact. I've stated this a couple of times already. We need to see that there is a partner that is adequately prepared to be able to demonstrate that evidence of impact. So that's a very important piece. And also serve that your collaborative and the organizations within it have the ability to serve as many low-income community members as feasible within the scope of the requested funding. So just to note here, we're not assigning a number of individuals that we want you to reach. We want you to kind of, negotiate that with the partners that are going to be a part of the collaborative, really look realistically at the individuals that you currently serve and who you could potentially serve with this type of project, and then submit that to us as a part of your application. So we want just, be realistic about the numbers that you think that you could reach over the 2-year period. The other thing is to administer regular programming efforts, right? We want to make sure that you are adequately prepared to initiate this work within a certain period. Our goal is to issue grants by the end of 2022 and announce those grants by December so that there's, enough time to initiate programming towards the first quarter of 2023. So we want to make sure that you are prepared as a collaborative to initiate that work as quickly as possible and to help individuals address as many of the health-related life goals as possible. And lastly, we want you to identify and activate action steps over the project period to support sustainability and maintain successful aspects of the collaborative partnerships. In your application, we're going to be asking you, how do you plan to incorporate sustainability as a part of your day-to-day, activities? We know that sustainability is not something that can be delayed until the end of the application, until the end of the implementation period. It has to be something that's incorporated throughout that process. And so we want to see from you, as a part of that application, how do you intend to sustain some of these activities? And some of it may be very convenient because it'll be based on some foundational work that you already do. But maybe there's some new innovative aspects that you'll need to consider how you're going to sustain those things as the grant period ends over at the end of the second year. So this is a funding opportunity that comes through Texas Health System. So we call Texas Health Resources is our system office. So community health improvement is within the Texas Health System. This is not funding that's coming from our hospital. So please don't reach out to the hospital asking about, questions about funding opportunity. These grant awards are very specific to a strategy that Texas Health had initiated back in 2018 called Community Impact. And the goal of Community Impact is specifically to address social determinants of health. And so every couple of years, we take a look at our strategies. We either continue some of the work that we started in the previous 2 years, or we revamp. And for the last 4 years, in fact, we have been doing work on behavioral health in the Dallas-Rockwall region. And so we're excited to be doing something different for these next 2 years, for 2023 and 2024. Hope that you'll embark upon that process with us. The grant awards, as we've indicated in the RFP, are for a period of up to 2 years. We say that because some organizations, may feel more comfortable applying for a one-year grant. And it is possible that, those that initiate the program may not be able to continue over the course of the 2 years, or do not have adequate success to be able to support that continuation. So that's something that we're always looking at. So the total amount available for funding for the region is $700,000. That means that it's one lump sum, right? We're not looking to fund multiple awards of $700,000. You don't have to request, excuse me. You don't have to request the full 700,000, but up to 700,000, considering the scope of the work and the level of effort that your collaborative is planning to do. So if you're only addressing one zip code, it's not likely that you'll be able to get up to the full $700,000 of funding, because we are looking to address multiple zip codes. So that's just something to consider. The final award amount will be contingent upon submission of a detailed and reasonable budget proposal and a work plan, and may vary based on approval by the THCI Dallas Rockwall Leadership Council. You'll note that once you register to submit to complete an application, that there is a spreadsheet there with a budget template as well as a work plan template. And all you need to do is complete those two templates, and you're good to go along with your application. The award increments will be based on a 6-month budget period, unless, otherwise approved. In some cases, we have made adjustments for certain community-based organizations based on need, and is contingent upon satisfactory progress. So that means that we will initiate your first payment if you're granted an award in the beginning of 2023. In the next 6 months, once we do a review of your grant, if there isn't sufficient progress, that payment may be delayed, or we will need to address what issues there are before issuing that next payment. So that's usually how that works. We are not requiring any matching or cost sharing for this grant. Organizations that have applied for previous THCI grants and were not awarded previously are eligible to apply. If you've received funding in the last 2 grant cycles, you are not eligible to apply as a lead agency without prior approval. So those are the specifics on the funding opportunity. As far as what we're looking for, our preferred experience is, as far as organizations experience, is groups who are already providing evidence-based or evidence-informed strategies that address social determinants of health. We're looking for groups that that have specific expertise working with communities that face longstanding systemic health and social inequities, and also have experience with diverse communities. Obviously, given the landscape of our region, we understand, and it's very evident that we have highly diverse populations, and so that is an important aspect of this work. And then also who have the capacity to accomplish the proposed activities in a timely manner and within a reasonable budget scope. So as you're thinking through how to complete your application, make sure that there's enough information there to help the reader understand, the reviewer understand how equipped you are to be able to complete the proposed activities within the timeline that you're suggesting and within the budget scope. So this is our review timeline. If you have not participated in the RFP process for Texas Health before, the way that we do it is we open the RFP as we have. The deadline will be due September 16th by 4 p.m. Central. Proposals should be submitted by the designated lead organization. We will not accept any proposals after the deadline. They need to be submitted in the portal as requested. Applicants are responsible for familiarizing themselves with the proposal portal to avoid missing the deadline. We unfortunately don't have enough staff to manage all of that, on a 24-hour basis. I wish we did, but we don't. And so just to avoid missing the deadline, it's good for you to just go in and go ahead and register and get yourself set up. So at least you have your login and password and all of that in time. We will be taking some questions through our email portal, and any questions received before 4 p.m. on August 19th will be responded to. After August 19th, we may or may not respond in a timely manner. So we want to be, just want you to be cognizant of that so that we can get questions answered as quickly as possible for you. The next step in the process is the review. We usually take approximately a month to do reviews. There's a few reasons for that, depending on the quantity of applications received, as well as the process internally that we have with our leadership council. Each of the regions, including the Dallas-Rockwall region, has a leadership council that oversees this process, and in our case, it's about 15 individuals, and so it takes a little time to coordinate all of the reviews with them and do the scoring and discussions and whatnot. So that's why it takes a little bit of time. In certain cases, depending on the number of applications we've received, we may ask applicants to present their proposal to the Leadership Council via a virtual meeting, just like similar to this one, where you would prepare a slide deck and do a quick pitch, no more than 10 to 15 minutes on what you are proposing and why it is important to be funded. The next step in the process after that review has occurred is the grant award and onboarding. So we're hoping that by November 30th, we will be able to issue notification of grant awards and let you know if an organization has been funded or not. The recipients of grant awards will be required to attend an onboarding seminar or webinar and a one-on-one call with their assigned program manager. For the Dallas Rockwall region, that program manager is Narsha Davis, who is on the call currently. All right, so I've given you my spiel. Hopefully, I didn't go over too much time. And we are looking forward to your questions. So I'm actually going to share the contact information. That's the email that you'll want to send any additional questions to. But right now we are open to your questions. So I'm actually going to stop the screen share. Narsha, you can actually go ahead and stop the recording as well. And then we'll get started with the Q&A, and I'll be able to see folks.